name is Kristen Pfeiffer, and I would like to welcome you all to the 3rd Annual State House Awareness Event for World AIDS Day 2014. This event is sponsored by the Rhode Island HIV Prevention Coalition, which is comprised of approximately 20 organizations throughout the state. The coalition was formed a few years ago. We wanted to create a forum for community-based organizations and other agencies throughout Rhode Island to work together to prevent HIV through information sharing, advocacy, strengthening partnerships, and raising public awareness. Today we commemorate the 26th Annual World AIDS Day, when people around the world gather to show our support for those living with HIV, celebrate the lives of those we have lost, and bring awareness to that this is still, in fact, an epidemic affecting millions of people around the world. And particularly here in our state of Rhode Island, we have much work to do so we can get to zero, truly get to zero. HIV is still a very serious disease. Yes, people live longer, healthier lives, but they can never rid the stigma and discrimination that comes with the diagnosis. The CDC estimated that having HIV endures a lifetime cost of approximately $400,000. So our fight continues until there is a cure. I would like to recognize the coalition members who are here with us today, if you don't mind standing briefly. I want to thank you for all of your tireless work to continue this fight. Or not. Thank you. And a special thank you to our speakers who are with us, the Governor, of course, Representative Blazejewski, Dr. Amy Nunn, and Josh Kilby. And I also like to welcome Congressman Cicilline today. And a very special thank you to our Planned Parenthood partners of Southern New England, providing our refreshments. We are so grateful for you. Thank you. Without further ado, Governor Chafee.
Thank you for joining us here in our beautiful state room. Of course, behind me is the great Gilbert Stewart painting, and we're very proud of the prosperity that we enjoyed at the turn of the century, 1904, when this building was completed. And we're here to commemorate World AIDS Day today, 3rd annual commemoration. And my own experience was in the 80s. As we learned about this strange new disease that was affecting populations and the stigmas that were attached with that. And it took a long time for people to actually, the health community and citizens to come to grips with what was occurring and to band together to make sure we treated it. And the truth was AIDS was like a grim reaper going through the creative community. And it's regrettable that it took so long for us collectively to come together. But we're here now in 2014, saying that we've come a long way in Rhode Island. In particular, we're always proud of what we do in this state, our great history here, and to thank all those that worked so hard over the years and decades to get to zero. It's great to join Dr. Nunn and Josh and Brandon and our great Congressman Cicilline. Keep up the good work. Thank you.
We could have the Congressman say a few words, please. Thank you.
Good afternoon. I'm delighted to be able to be part of the ceremony, and I want to apologize in advance. I'm actually on my way to the airport, so when I leave, it's not because I'm not really interested to hear Dr. Nunn, but because I don't want to miss my flight. But I want to begin by thanking the Governor, who has really, every year that he's been in office, made certain that the State House was open for a commemoration of World AIDS Day, and thank him for his leadership in this issue. And as I look around the room, I see many wonderful people, Phil Kane and Annie Sylvia, Paul Roberti, Steve Moorhead, people who have been involved in advocacy and education and helping to really rally our state around this issue for a very, very long time. And lots of new young faces that have been doing this work more recently. But this is a day where we commemorate and remember the people we've lost to this terrible disease, where we recommit ourselves as a community to continue to educate the next generation, but also continue to fight to be part of a solution around the world to eradicate AIDS. We are fortunate to live in a country where people often have access to high quality health care and treatment There are people afflicted with HIV and AIDS all over the world who are denied very basic health care because of where they live. And so this continues to be a health pandemic all around the world. While we have made progress in terms of treatment, there are still obviously millions of people affected by this disease. And I hope that we use this occasion not only to remember the people we've lost, but to recommit ourselves to being part of the solution to eradicate this disease from the face of the earth. And thank you to everyone for the part that you're doing, everyone in their own way, to help bring an end to this public health crisis. Thank you.
Thank you, Congressman. Our next speaker is State Representative Blazejewski. He is from District 2 here in Providence County. We're excited for him to be here today. He's currently serving on the House Judiciary Committee and the House Rules Committee. Thank you so much for being here.
Thank you very much for this opportunity to join you here today to commemorate World AIDS Day. I'd like to thank Governor Chafee, and thank you for that very kind introduction, and Congressman Cicilline. I'd also like to thank my fellow speakers, Dr. Amy Nunn and Josh Kilby and Brandon Fernandez, for their tireless efforts. I represent the city of Providence, and the city of Providence has more new cases of HIV than any other county in Rhode Island, in fact, more than any other county combined. And so I, in my community, see the impact of HIV and AIDS. And I just want to thank the Rhode Island HIV Prevention Coalition for inviting me here to join you today, because your efforts are so important to continue education, community outreach, and community involvement, which is the real way that we can continue to combat HIV and AIDS here in Rhode Island. I'd like to point out one thing that the Rhode Island Department of Education has been working on in coordination with our high schools to work with the Center of Disease Control to work on combating the disease and stopping its spread among high school students. It's an issue that's important to me, and I'd like to commemorate the Department of Education for doing it. And thank you again for all joining us here today. This is very important work that we're doing, and we need to continue the education and community outreach here in Rhode Island to work on HIV and AIDS. Thank you very much.
Our next speaker, Dr. Amy Nunn, currently serves as the Assistant Professor of Behavior and Social Sciences at Brown University, School of Public Health. And she is also the Executive Director of the Rhode Island Public Health Institute.
Thank you so much for the opportunity to be here today. I want to start by acknowledging someone really special in the room, and that's Dr. Charles Carpenter, who I see seated quietly in the back row. But he has really led the charge in the fight against AIDS in this state for the last 25 years. And he's a mentor to pretty much everyone who has made a difference in the fight against HIV in Rhode Island. He was also willing, at a time where it was considered very provocative and controversial, started taking care of people in the correctional system and then started training people to do that, and has since gone on to lead one of the nation's leading centers for HIV/AIDS research. He's one of my mentors. He's also mentored a lot of other people in the room, including my partner in crime, Philip Chan. And also I see a lot of other people who've been doing work in this state a lot longer than I have around the room. Paul Liberty, Paul Fitzgerald, Philip Chan, Anthony, and I apologize in advance if I've missed other people around the room. So today I want to stir the pot. Those of you who know me know that I don't stray away from controversy, and I think it's important to talk about who's getting newly infected in this state and what we need to do about it. This morning, Mike Fine called me on my cell phone and wanted to make sure that I knew exactly how many people have been infected this year, and he also reminded me that even though in the last few years there have been declines in HIV infections, this year there's been an increase of 17.5%. This isn't something that we've heard a lot about, so I want to bring it to everyone's attention and sound the alarm bells. I also want to really commend Dr. Fine for his efforts to take this on in a big way. I don't know of any other director of health department, director of any other health department in the country who's really committed to getting new infections down to zero. We might be the only state in the union where this is actually possible. I think that is something that we should really think about. We have really decreased new infections down to below 100, I think, over the last couple of years, which is remarkable by any measure. A lot of that is due to the work that has been done in the correctional system and the willingness of people like Dr. Carpenter, Dr. Flanagan, and Dr. Jody Rich, who take care of people inside the correctional system and also when they are released. This is a remarkable public health achievement, and it's one of the reasons that we have had declines in HIV infection over the last decade in Rhode Island. But I think one thing that's really important to remember is who's getting infected today and what it means about advocacy. Today, over half of the new infections are among men in Rhode Island, and we know from Dr. Philip Chan's study that a lot of these people are meeting online on the internet. The problem is our prevention response hasn't been as quick as those websites that are making money hand over fist and helping people hook up online. So we really have to get our prevention response aligned with how people are becoming infected. It's important, though, that when we do this and respond to this crisis, it can't be in a way that further promotes stigma among men who have sex with men. We know from the 1980s that absolutely didn't work. So it's time that we really have to rethink our prevention strategies and think about how we get prevention messages out on the internet in really effective ways. This might mean that we need to partner with a lot of those online web companies. I would posit that they do a much better job of reaching the highest risk people than we have done in the public health community, and it's time for a revolution and to really think about how we can work with them. We know now that people who are on antiretroviral treatment can live long, healthy lives. We also know that people who know their HIV status tend to reduce their risk-taking behaviors. All treatment starts with testing, so we really need to be working with these online companies to promote testing and treatment, and also our new prevention technologies like pre-exposure prophylaxis. Dr. Philip Chan leads the only PrEP implementation program in the state of Rhode Island, and it's considered a national model by any measure. We need to be promoting that clinic, pre-exposure prophylaxis, which is one pill once a day, which people who are at high risk for transmitting HIV can take to reduce the chances that they acquire HIV. Why aren't we hearing more about this? We ought to be promoting this at every possible opportunity with online and digital media outreach campaigns. And I would challenge all of us in this room to get involved in this way. We would really like to work with the Prevention Coalition on this kind of initiative. And this will also involve talking to people that use the websites. I downloaded a lot of these to my cell phone because I didn't really know how to use Grindr. You know, you end up in public health, you have to step out of your comfort zone a little bit and understand the technologies that people are using. I remember my husband looking at my phone saying, "What is this?" But these are the kinds of things that we need to do. So I would like to challenge everyone in the room that we really need to think about how we can enhance our prevention strategies by working with these companies online and also shaming them into corporate social responsibility. Why aren't they doing more? If Coke and Pepsi and Philip Morris and all the other naughty multinational companies are pouring money into corporate social responsibility programs, we ought to be demanding that they do that as well. So stay tuned for my next advocacy campaign. The other, thank you. It's my brother. He's plant. The other thing that I think we really should think about is routine HIV screening. Since 2006, the Centers for Disease Control and Prevention have recommended that all Americans between the ages of 13 and 65 get screened for HIV once a year. This is not happening This is not happening around the country, and it's not happening in Rhode Island. We should be working with federally qualified health centers in this state, as well as primary care practices, to start implementing routine screening policies. That means that everyone who walks through the door for any primary care visit, obstetric visit, family planning visit, or wellness visit should be offered an HIV screening as part of their routine clinical care, along with their weight, their cholesterol, and all the other vital signs that we take. These are the two things that I hope that you remember from my speech today. One, that we should be working with online website companies and that we should be shaming them into corporate social responsibility. And two, that we should be screening people for HIV routinely at all of our primary health care centers. I think if we were actually able to execute those two action steps, we could address the state's rising rates of HIV infection. We would have a good chance of getting down to zero, especially with all of the servants that we see in this room who serve the public who are at risk for HIV, and a visionary leader like Michael Fine, who's willing to make a bold statement about getting down to zero. So I'll leave you with that today, and thank you very much for this opportunity.
Our final speaker today graciously agreed to speak with us about his recent experience with PrEP and offer a perspective on prevention. Josh?
So my first question is for Dr. Amy. Didn't I hit you up on Grindr last night? Anywho. Hi, my name is Josh. I'm a healthcare worker and queer activist and consider myself to be pretty well informed and connected. And yet, had you asked me about PrEP as recently as September, I would have wondered what you were talking about. And I'm up here because I feel that the word PrEP needs to be on the lips of everyone who is sexually active and the people they love. So Dr. Amy covered what PrEP is, the pre-exposure prophylaxis. It's a very easy once-a-day drug that kills HIV before it can infect you if you are exposed to it. So being newly single after 5 years and being sexually active, this naturally piqued my interest. You know, if a once-a-day pill can help prevent an unwanted condition, why wouldn't you take it? But for good measure, I reached out to where all good arguments take place, social media. And the results were somewhat not surprising, but they're worth teasing out. Two people who, you know, are my friends reached out to me privately to tell their stories, which were well received and appreciated, but I wonder why wouldn't they feel safe to say publicly that they were PrEP users, until I considered the other responses that I received, most of which were positive. But there was a strong current of people who were telling me that if I weren't being, you know, their word sleazy, I wouldn't have to worry about this, or that they felt that this pill would encourage bad behavior. These lines of thought are nothing new. You know, 54 years after the release of the birth control pill, and 41 years after safe and legal abortion became the law of the land, people are still saying that contraceptives will encourage bad behavior. But I have news for them. Bad behavior does not need to be encouraged. And furthermore, there's nothing bad, dirty, or shameful about sex. We owe it to ourselves, our partners, and the people we love to first and foremost enjoy ourselves and to do all that we can to protect ourselves and others. We as a society need to come to grips with the fact that sex-positive and queer-inclusive sex education is not part of the fact that this is not part of our public education system is nothing short of a public health crisis. Creating a layer of young people with lots of misinformation and questions and afraid to seek out answers for fear of judgment. And this is dangerous. Silence literally equals death in this case, to borrow a phrase from ACTA. I, along with my doctor, Dr. Chan, thank you, did decide that going on PrEP was the right decision for the type of life I lead. I was very fortunate to thus far not experience any of the side effects that people often do, the nausea, vomiting, and all that. And if you're wondering, it didn't encourage any more or less bad behavior. To conclude, I feel that I'd be remiss if I did not discuss how equally important access to this drug is to its availability. I'm very lucky in that I have a good job with good health insurance, so access to PrEP was no issue to me. But there are so many people in vulnerable populations, and I'm thinking especially of sex workers, of IV drug users who don't have jobs or health insurance, who could not afford to pay the upwards of $1,500 for a monthly supply of PrEP out of pocket. PrEP has the potential to make new HIV infections a thing of the past, but if it cannot do that if no one's ever heard of it, and the people who need it the most cannot access it. These are the facts, but our challenge as healthcare providers, lawmakers, activists, and people who want to see a world without HIV/AIDS is to overcome them. We have come so far already. Research in tandem with activism has taken HIV infection to a death sentence to what is mostly a manageable chronic condition. Mostly. It still sucks. And we have the capability now to prevent it in the first place. So we need to be screaming about this from rooftops, flyering every gay bar, and yes, talking to Grindr and Scruff and Manhunt or whatever else gay people use to hook up. And the phrase, ask your doctor about PrEP should be as recognizable as a slogan as get tested and know your status. So I'll leave you with that. Thank you.
Just a final thank you for all of you who came today. I'm grateful to see all of the faces here, and as well as the governor and Representative Wojciechowski and our speakers. Thank you. I know the choir is in the room, so I don't have to really preach to you. But remember that today is just one day, and there's a lot more to do and a lot more education and awareness as we move forward tomorrow and beyond. One day is not enough for people when it affects their entire lives. So thank you again for being here.